staff to develop that, and our team physician out of TRIA to develop that. We kind of looked all around. We didn't know where to start because it had never been done before. So I kind of talked to the other athletic trainers at the conference, our team physician, and what the NFL was doing, which really wasn't that good at that time anyway. But that's something also to, to look at what other groups are doing. And ultimately, we kind of fell into what Georgia was kind of doing, and kind of took off of what they've been doing. Well, we have a graduated progression to return to play. Now, that doesn't mean that everyone's going to get better in 7 to 10 days, just like we talked about. 90% of my student athletes who tell me right away usually get better in that 7 to 10 day range. But what we do is first you remove them from competition. You evaluate them. It depends on the situation. I usually use a SAC test on the field. I have a mini SAC test that I keep, a standard assessment of concussions I keep in my pack on the sideline. There's also great apps on your phone now that you have the SAC test, you have the SCAP 2, all that great stuff that if you're going to be a coach or you're going to work with student athletes, wonderful tool to have. You don't have to carry a piece of paper that's laminated like I have. I'm old. Not that old, but old enough that I didn't have a cell phone until I was out of college. And so from there we diagnose them with a concussion or not having a concussion. Most times I'm going to err on the safe side, remove them from competition if they have one single symptom. If they have a headache from a collision, I'm automatically removing them from that practice or that competition. From there we reassess again. If we're on the field, we reassess when we get back to the athletic training room. And then they sit for a minimum 4 days symptom-free. So you have a concussion on Saturday, you're not symptom-free till Tuesday. You sit 4 more days after Tuesday until you're symptom-free. Within that time, our doctors come down. He's probably evaluated you, especially if you're not having complex symptoms. He'll evaluate you and say, yes, we're on the right track. Continue on that track. If you have complex symptoms, since we work with TRIA Orthopedic Center, they have just opened a concussion clinic. We send them up there to see Dr. Knoll as our doctor of choice up there because he's seen all our athletes this last year with complex symptoms that I can't remember the names of the other physicians that are working with them up there. Once they've seen Dr. Knoll, they also see a physical therapist for activities for return to play therapy, which is wonderful. But from there, we've also done an impact test on them to see how well they've done. That goes up with them, especially complex symptom athletes as well. Once they've made that 4 days symptom-free, we do an exertional testing on them. So it's a minute of push-ups, minute of sit-ups, not exactly in this order. 10 minutes of bike riding at 70% of your maximal heart rate. 10 minutes of running at 70% of your maximal heart rate. Minute of push-ups, minute of sit-ups, so not going in the right order, sorry. And then from there, we're going to get out and do some sprinting activities, some sport-specific activities. If you pass that, excuse me, that's your only thing you do that day. So you had to pass your impact